Chair lays out House Bill 1644. Chair lays out a complete substitute. The committee, House Bill 1644, recognizes Representative Oliverson to explain the bill.
Thank you, Mr. Chairman and committee members. It's a pleasure to be with you and lay out House Bill 1644. House Bill 1644 decriminalizes the possession of fentanyl testing strips. I think those of you that were here last session, you all got a pretty good dose, no pun intended, of legislation and explanation as to why the crisis that we have ongoing. Texas is one of only a handful of states that actually criminalize the possession of testing strips. If you take out your smartphone and go to Amazon, you can actually put in fentanyl test strips. I did it this morning. There's a 25-pack here available for $24.99. However, when you put it in your box and you try to purchase it, it will tell you that you are not able to buy those because you reside in the state of Texas, and it is a criminal offense for you to possess those devices. So why is that important? As an anesthesiologist, I've used fentanyl in the operating room for more than 30 years. I have tons of experience using it. It is the most potent narcotic out there today, and it is 100 times more strong than morphine. We talk about drugs and how strong they are. In medicine, we use the word potency, and potency refers to the amount of drug necessary to produce the desired clinical effect, in this case, pain relief. So fentanyl is 100 times stronger than morphine, which means that if I took a milligram of fentanyl and introduced it into a liter bottle of water, I've just created an entire bottle of morphine, which is enough drug to anesthetize and probably kill every person sitting in this room. In fact, myself, when I give doses of as small as 50 micrograms in the operating room, I can notice a patient will stop breathing, lower their heart rate, lower their blood pressure, sometimes to the point to where I even have to give medicine to raise the blood pressure back up. That's a single dose of fentanyl, and what we're talking about is sometimes 10, even 100 times that, which is what's commonly found in the drugs. Why is this a problem, and why do we need testing strips? Well, obviously people use drugs. I wish they didn't. I want to be clear that I'm not somebody who supports the idea of illicit drug use, but we live in a country, we live in a world where drug addiction is a mental illness, and I want everyone to get treatment for it, but I can't treat you when you're dead. And so when you're dealing with a drug that's that potent and that powerful, and the key factor here is that greater than 95% of people who come in contact with fentanyl on the streets did not know that they were taking fentanyl when they were taking it. They thought they were taking a Xanax, or they thought that they were taking some other pain pill, and accidentally they were exposed to fentanyl. And as we learned last session, and as you're hearing today, one pill often does kill. And so I liken the fentanyl testing strips to essentially a mine detector. You know, if you're going to walk across a minefield anyway, it's useful to have a mine detector, because most people who were able to detect the presence of fentanyl in a drug that they didn't know was fentanyl would probably have the good sense not to take it. You will probably hear from folks today, and there are countless families, some of whom probably live in your districts, that have lost loved ones because of an accidental exposure to fentanyl. They didn't know they were taking it, but by the time they figured it out, it was too late. I want you to recover from drugs and alcohol if you have a problem. I want you to get into a 12-step program, and I want you to be sober. But none of that matters if you're dead. And so all this bill does is simply seek to decriminalize a device which you can buy on Amazon for 99 cents a piece that will save somebody's life. And with that, members, I'll take any questions you have, and I'd like to reserve my right to close.
Thank you. Representative Schofield.
Representative Oliverson, do you know the original reason why the legislature made him illegal? I mean, the only thing that occurs to me is that they didn't want to make it easier to take illegal drugs by being able to test for them. I can't think of another reason why the legislature would have outlawed them.
Yeah, I don't have a really good explanation. My guess is the people who thought that was a good idea probably don't understand how potent and dangerous fentanyl actually is as a substance. It is just classified as drug paraphernalia, and so it's subject to the same criminal penalties as any other type of drug paraphernalia. And if you manufacture them here in Texas, it's an even higher level of criminal penalty.
And are the strips just a yes/no test for presence, or are they a
Correct.
potency test?
You can purchase testing devices and equipment that would allow you to measure the strength, but the strips essentially just test for the presence, which really is what we want.
So we're not enabling a drug user to go, oh, this is a safe dose, I can take this without dying. We're just telling them, hey, there's fentanyl in this.
Yeah, I mean, it's literally it's the equivalent of saying don't step there. If you step there, you will die. And I forgot to mention also that the committee substitute, Mr. Chairman, we added xylazine, also known as tranq, upon conversations that we had last session, simply because it's a similar drug that lowers respiratory rate, lowers heart rate. People don't buy tranq on the street intentionally for the most part. Same as fentanyl, it makes its way into the pill as a substitute, and so it has also been responsible for a number of deaths.
Then I better ask you a question on the wording. The original wording in the filed version specifically said fentanyl, alpha, methylfentanyl, or other derivative of fentanyl. Now we say presence of a substance listed in penalty group 1B or xylazine. Is 1B the same as fentanyl, alpha fentanyl, and derivatives of fentanyl?
Well, that's a good question. I'm going to have to look that up and get back to you on that one. We wanted the bill to be bracketed specifically for fentanyl and its derivatives and xylazine.
Thank you.
Representative Simmons.
Thank you, Mr. Chairman, and thank you, Dr. Oliverson, for bringing this bill forward. As a mother with a child with sickle cell disease, my daughter had her first dose of fentanyl at like 8 years old because she was having a severe pain crisis. And so when you hear about what this does to people when they have access to it on the streets, it really kind of muddies the actual effectiveness and how good of a drug this is for people who are experiencing extreme pain. But just to get back to my question, are you aware of any correlation where states that have these laws where it's not considered drug paraphernalia, correlation between better outcomes for people seeking treatment, better outcomes for reducing deaths and overdose deaths? Thank you.
Yes, so certainly that is the case. I think we have some folks here that may testify specifically to that. But again, that this is, I mean, it's fairly straightforward from the standpoint of if you can test for the presence of something that may kill you. I mean, it would be no difference than being able to test for arsenic, or some other poison, because essentially that's what the fentanyl becomes. It becomes a poison, and people don't realize they're coming in contact with it. So certainly, now the caveat is obviously, Representative, you have to use the strips. And so if having access to them, you still have to use them to know that that chemical is present. But yeah, and I think I've also heard from advocates that say that, it sort of has a self-policing behavior on the flip side of that in terms of the folks that are out there putting these drugs on the street, because somebody finds out that so-and-so's, stuff is bad, and then nobody wants to buy from that person anymore. So I mean, I hear the argument of like, oh, we're making drugs safer for people to use, but the reality is that when you're dealing with one pill killing you, it's hard to recover from addiction when you're dead.
And really quickly, so this is just for individuals. Are there any organizations or groups that are able to access these strips, or is everybody banned?
Everybody would be able to access these strips. They would be decriminalized in our state, and they would no longer be considered drug paraphernalia. So I think I know where you're going with this. So groups that are interested in harm reduction would be able to provide these strips to folks that might be at risk.
Thank you so much.
Yes,
Thank
ma'am.
you.
Thank you. Representative Johnson.
Dr. Oliverson, just
Yes,
like
ma'am.
last time, I'm going to support the legislation because I do agree that if we can reduce harm to kids, we should absolutely do what we can there. I do have one question, if I remember from our discussions on this last session. These strips are not completely foolproof, meaning even though you're using the test strip, if you get a certain spot in the pill that doesn't have the detection, there could still be a risk. Am I remembering that right? Or just so people realize this is not the end-all, be-all or solve to the problem. You're still at risk if you're choosing to do drugs, or did I misremember that?
I think you're correct in that, theoretically that's possible. Now, in terms of a pill, if the drug is in the pill, it's probably not likely to be on one side of the pill versus another. And so theoretically, taking part of that pill, crushing it up, and testing it for the presence of fentanyl would be sufficient. Fentanyl is fairly lipid soluble, and so what that means is that it's a fat soluble medication, and so it tends to diffuse pretty well. I would also point out that there's an urban myth out there that if it comes in contact with your skin that you're going to die from it. That's also not true. I get it on my skin all the time in the operating room unintentionally, and I'm still here. So, yeah, great question. Thank you.
Representative Jones.
I can see you're still here.
Yes, ma'am. As are you. Glad to see you.
Yeah, you're right about that. Never been in contact with fentanyl as far as I know. But I enjoyed serving with you last session on public health. You had a lot of insight. And in our discussion we had last year when this came up, we're talking about people who aren't drug users, right? They don't think maybe they want Adderall and they believe somebody is trustworthy with the Adderall that they get. And I had to tell one of my friends, you don't know what you're getting. And they're like, oh no, they're legitimate. I'm like, you know that how? I mean, you're not going to a pharmacy, you're not getting it from a doctor. And at the end of the day, drug dealers are drug dealers no matter the reputation of the drugs that they are supplying. And so one of the reasons that you brought this is because some of the street drugs look legitimate. Like they look like they were pressed because they're very sophisticated in how they do it. And this will even allow for people who think they're getting Adderall or Xanax to make sure that there's no fentanyl, correct?
Yes, ma'am, that is correct.
Okay, thank you.
Yes.
Members of the-
They even make them look like counterfeit, so like you'll get a pill that'll look like it's an OxyContin pill, but they use fentanyl as the active ingredient instead of the oxycodone. And so you think you're getting something. I remember a story, anecdotal story, of course, but pretty sad. It was a parent telling me about their 25-year-old son who went for a job interview out of state and couldn't sleep. And, it was late, couldn't get access to a doctor or anything. So he, used the device here, found a way to get a Xanax, or what he thought was a Xanax, and ended up not being Xanax, and he died.
And that's exactly what I was talking about. There are very many people, college students who need Adderall or something, and they maybe aren't insured or don't have access to it or can't afford a doctor to prescribe it, and they go get what they believe to be safe. And that's why the decriminalization of fentanyl strips, I think, is so important, so that at least people who are doing something they probably shouldn't be doing anyway
Yes,
can
ma'am.
check what they've purchased.
Yes, ma'am.
Okay, members, other questions? Okay, thank you. We'll reserve the
Thank
right
you.
to close. Okay, the chair calls Adam Bazaldua. Have you registered as Adam Bazaldua?
Basil Dua.
Thank you.
Yes, sir.
Bazaldua.
Thank you, Mr. Chair.
I have you registered testifying on behalf of the city of Dallas and yourself, and you are testifying for House Bill 1644. Is that correct?
Yes, Mr. Chair.
Thank you.
Thank you. Good afternoon, Mr. Chair, and members of the committee. Thank you, Doctor, for filing this bill. My name's Adam Bazaldua. I am Dallas City Council member representing District 7, and I serve as Deputy Mayor Pro Tem for the City of Dallas. In accordance with the city's legislative program, I'm here to testify in support of House Bill 1644. In 2022, I helped form an opioid strike force within Dallas alongside my colleague, Councilmember Paula Blackman. We brought together stakeholders across the city, county, school districts, and transit entities and nonprofits to address the rising number of opioid overdoses and deaths across our communities, regardless of demographic. Part of the strategy of the strike force has been harm reduction. The city of Dallas has made Narcan available in all of our city facilities and provided training to employees on how to administer it when it comes to someone who is overdosing. Dallas ISD has now also amended their rules to allow the administration of Narcan on its high school campuses. We are working together to create safer communities, but we need your help. Bills like HB 1644 are a major step forward towards preventing lethal overdoses and its impacts to every community in Texas, from the richest to the poorest, from urban to rural. Many overdoses are due to the consumption of other drugs laced with fentanyl, including drugs that are legal with a prescription, such as Adderall or Xanax. A person may believe that they are consuming a non-lethal dose of another drug without knowing it has a concentration of fentanyl, potentially leading to health emergencies and death. HB 1644 decriminalizes life-saving tools like fentanyl testing strips. These strips allow for someone to test for the presence of fentanyl within their drugs, alerting them to its presence before consumption. They have been proven to lower the risk of overdose and therefore save lives. Harm reduction strategies should be supported by everyone who wants to end this pandemic. While they alone are not enough, it is essential we provide tools to prevent overdoses to those who are highest at risk. Passing this bill does not reduce the need for other comprehensive treatment of addiction, mental health, or drug enforcement. It just helps to ensure that people are less likely to consume fentanyl without knowing, and therefore suffer an overdose that could cost them their lives. We ask that you please support House Bill 1644. Thank you for your time and attention to this matter, and I'm pleased to answer any questions.
Thank you. Members, questions? Okay. Thank you for your testimony.
Thank you, Mr. Chair.
Chair calls Anna Duncan. Have you registered as Anna Duncan? You're testifying on behalf of Vocal Texas. You're testifying for House Bill 1644. Is that correct?
Yes, sir.
Okay, proceed.
Good afternoon, Mr. Chairman, committee members. My name is Anna Duncan, and I'm a leader of Vocal Texas, and I'm here to support House Bill 1644. I am someone who has experienced fentanyl overdose and has been directly impacted by this issue. I have survived my overdose because there was someone to revive me, but that's not the case for many others. If I had access to fentanyl testing strips, I would have never overdosed in the first place. Now I can say I've been in recovery for 12 years. I am here today because too many people are dying of overdosing in Texas. Overdose death has been surged by 75% over the last 5 years. In 2023, fentanyl accounted for over 2,300 deaths in Texas. That is equal to 15 Texans per day. That is too many lives. All overdose deaths are preventable, and this bill will support and prevent so many of those deaths. Drugs testing tools such as the fentanyl and silencing testing strips are affordable and effective way to prevent overdoses. They are strips of paper that can identify the presence of fentanyl or silencing in a small amount of sample in a few minutes, and they only cost about $1 each. For many of the abilities to test fentanyl is the difference between life and death. Not everyone has someone nearby to administer Narcan and save their life. This is what testing strips are for, to prevent overdose ever happening and keep people alive, people like me, in all Texas. Please support this bill to save lives. Thank you for your time and attention.
Thank you. Members, questions? Representative Jones.
I've got a question. Since you have personal experience, do you think if this is decriminalized, do you think people would use it before they try whatever it is they have?
No, I don't think so.
So you don't think that people who, you don't, maybe I didn't ask the question right. So do you think if these were widely available from harm reduction places, or if you can afford it yourself on Amazon, do you think the people that are using will use the strips to test?
Makes sense now. Yes.
Okay, thank you.
I'm sorry.
Okay, members, other questions? Okay, thank you for your testimony.
Thank you.
Chair calls Judy Gradford. Okay, I have you registered as Judy Gradford. You're testifying on behalf of Austin Justice Coalition and yourself, and you are for House Bill 1644. Is that correct?
That is correct.
Okay, you may proceed.
That is correct. I am an Austin resident and also a retired social worker and a mother and grandmother. And very much in favor of this bill. This bill is an effective way to save lives and give people a road to recovery. 75% of the people with addictions recover over time, but they don't recover if they're dead. And this bill will help them to survive. In Austin, back in April of ¡24, we experienced a multiple death experience. There was emergency services reported that in a 72-hour period, there were 70 calls. There were many people that were lost. And if we had had test strips, we might have been able to avoid some of that. So this bill not only saves lives, but it actually saves money as well, because it will reduce the amount of emergency services that municipalities will have to provide. And this bill is essentially a win-win for all of us, for the people of Texas, for the Texas State Legislature. And last time this bill passed with overwhelming support in the House, and we all need to work together to make sure that it passes in the Senate as well, because we need this bill for all of us. Thank you.
Thank you. Members, any questions? Thank you for your testimony. Chair calls Cynthia Humphrey. Have you registered as Cynthia Humphrey?
I have.
You are testifying on behalf of the Association of Substance Abuse Programs and Texas Healthy Minds Coalition, and you are for House Bill 1644. Is that correct?
That's correct.
Okay, thank you.
And good morning, Chairman Van Dieven, committee members. My name is Cynthia Humphrey, and I'm testifying today for the Association of Substance Abuse Programs and the Texas Coalition for Healthy Minds. I'm also an individual in long-term recovery. And on behalf of these organizations, we are strongly in support of HB 1644. Drug poisoning deaths continue to impact Texas families and communities in significant numbers. In 2023, Texas experienced 5,093 fatal poisonings, with nearly half attributable to fentanyl. We've received some good news in this past year because there's been a kind of an overgrowing trend showing that overdoses are being reduced. CDC reporting 22% reduction nationwide and 10% reduction in Texas. And while this is certainly a hopeful trend, there is still much more we need to do, because thousands of Texans are still lost to a drug supply that is increasingly unpredictable, toxic, and deadly. Fentanyl remains the primary contaminant causing these overdoses, but other harmful substances are being found in the drug supply, including xylazine, which Dr. Albertson mentioned. We're also seeing that, if I can say this right, nitazines are also on the rise, and these are more forms of synthetic opioids, and some of them can be more powerful than fentanyl. So to reduce the risk of these fatal drug poisonings, drug checking is recognized as an important and proactive strategy, and testing strips are an inexpensive, accurate, and easy-to-use tool. Currently, as it's been explained, drug paraphernalia laws in Texas prohibit the use of these testing supplies, and this not only prevents individuals from taking steps to save their own lives, but also keeps first responders, law enforcement, and community drug testing programs from identifying these emerging contaminants in the drug supply before deaths in hospital occur. As I know it, the state drug paraphernalia laws were kind of established in the 70s, back when they were using it to test for kind of the purity of the drug, how good was the drug, as opposed to the danger like contaminants like
Ms. Humphrey,
fentanyl.
can you begin to close up?
Yeah,
Thank you.
sure. And I just want to say that we are very supportive of HB 1644, and we urge you to vote favorably and help prevent these unnecessary drug poisonings, deaths in Texas.
Thank you. Members, questions? Thank you for your testimony. Thank you. Chair calls Lauren Johnson. Have you registered as Lauren Johnson? You're testifying on behalf of dream.org and yourself, and you are for House Bill 1644. Is that correct?
That's correct.
Thank
Thank you
you.
so much. Yes, my name is Lauren Johnson. I am the Justice Director at dream.org. We are a national organization that works at the intersections of prisons, poverty, and pollution. I'm here in support of this bill. Not only do we have an opportunity to save lives, but we have an opportunity to reduce the stress on our first responders that have been just going nonstop for years. Last week, I had a conversation with a law enforcement officer who was telling me about their strong support for this. And not only their strong support for it, but how they had tried to be innovative a few years ago and bring this along with Narcan to help work to do life-saving techniques on the streets. When their county attorney advised them that they could not do that, their county attorney advised them that they could try it because they hadn't been prosecuted before, but that it was still against the law, which is a bad look for law enforcement. So, so I do want to reiterate that several conservative states have recently moved to decriminalize fentanyl testing strips, which marks a significant shift in a policy approach. We've got Utah, Kentucky, Mississippi, Kansas, Florida, Wisconsin, and as a matter of fact, 13 of the 16 states that have legalized fentanyl testing strips since January of 2022 had a Republican-controlled legislature. So this shift is driven by a growing recognition of the test strips as a tool to prevent overdoses rather than enabling drug use. And I'm happy to take questions, but I think y'all have heard a lot of really good testimony today.
Thank you. Members, questions? Very good. Thank you for your testimony. Chair calls Cole Weaver. Have you registered as Cole Weaver? You are testifying on behalf of CWA Local 6154 and yourself, and you are testifying for House Bill 1644. Is that correct?
That is correct.
Thank you. You may proceed.
My name is Cole Weaver. When did my mask off? My name is Cole Weaver. I am a certified mental health peer specialist, speaking on behalf of CWA Local 6154, which represents workers at Integral Care and Harris Center. Integral Care and Harris Center are the local mental health and intellectual and developmental disability authorities of Travis County and Harris County, respectively. As workers on the front lines of the opioid crisis, we have witnessed countless preventable deaths and poisonings at the hands of fentanyl and xylazine. I'm here to speak in strong support of House Bill 1644, legislation that will save lives, support our frontline workers, and protect our communities from the escalating threat of fentanyl and xylazine. We want to be clear. Testing strips are not paraphernalia, they are protection. They are the first line of defense between a deadly substance and a life saved. Across Texas, we are losing our loved ones to overdose deaths at staggering rates. Between 2019 and 2021, fentanyl-related facilities rose by nearly 400%. In Travis County alone, fentanyl deaths spiked 600% in just 2 years. In Harris County, the most populous county in Texas, there was an astounding 457% increase in fentanyl-involved deaths over the past 4 years. And now, xylazine, a dangerous animal sedative not responsive to naloxone or Narcan, is making the crisis even deadlier. People are dying and being poisoned not because they made a choice, but because they didn't have the tools to make an informed one. HB 1644 offers a clear and immediate solution. It removes outdated legal barriers that allows individuals, families, first responders, and healthcare providers to legally use and possess and distribute testing equipment. That simple change gives people the chance to detect what's really in the drug they're exposed to before it's too late. We must understand access to test strips does not increase drug use. That has been proven time and time again. What test strips do is reduce harm. They buy time for someone to seek treatment, time for a family to intervene, time for a first responder to arrive. Neighboring states like Tennessee and South Carolina have already legalized fentanyl testing strips. States like Utah and West Virginia have legalized xylazine strips, and the results speak for themselves. Those states have seen overdose deaths drop by as much as 28%, while Texas has only seen a 10% reduction. We are falling behind, not because we lack the tools, but because we failed to legalize them. HB 1644 is not about condoning drug use. It is about recognizing the public health reality we are facing. It is about giving emergency services the support they need. And above all, it's about saving lives. Local 6154 urges you to support HB 1644 because every person deserves the chance to stay alive long enough to find help. Thank you.
Thank you. Members' questions? Okay, thank you for your testimony. Chair calls Leah Kaufman. Show you registered as Leah Kaufman. You are testifying on behalf of Shatterproof, and you are for House Bill 1644. Is that correct?
Yes, that's correct.
Thank you.
So my name is Leah Kaufman. I am a Texas resident. I'm also Assistant Vice President of Public Policy at Shatterproof. We're a national nonprofit, nonpartisan organization dedicated to reversing the addiction crisis. We work across the country to remove systemic barriers to recovery and ensure that every family has access to tools that can save lives. I am here to speak in strong support of House Bill 1644. You have my testimony, so I'm going to kind of skip over a lot of this. It's already been shared. You've heard about the rise in overdose deaths, all kinds of different statistics looking at different time periods. But suffice it to say, it's been increasing since before the pandemic. You've heard about xylazine. And so I guess I would turn it to, on a personal note, I live in Hays County, just south of Austin. And a couple of years ago, we had 5 students who overdosed in the same school year. These are kids who are experimenting. They took a pill, they didn't know it had fentanyl in it, and these families are still grieving. Every time I come up I-35, I see the billboard with these kids' faces on it. And fentanyl test strips could have helped to can help prevent future deaths. You heard Anna talk about how easy they are to use. Obviously, this bill is not doing anything to legalize fentanyl or to change criminal penalties. It's just providing a resource that people can use. I think you had heard about the number of states that are already that have already decriminalized. According to LAPA, the Legislative Analysis and Public Policy Association, 45 states, including Tennessee, Georgia, and Florida, have already decriminalized these, as well as the District of Columbia. These states didn't act to encourage drug use. They acted because their communities, law enforcement leaders, and public health officials recognized the urgency of keeping people alive long enough to get help. So HB 1644 is a smart, targeted solution. On behalf of Shatterproof, I thank you for your leadership on this issue and respectfully urge you to move this bill forward.
Thank you. Members, questions? Okay, thank you for your
Thank you.
testimony. Is there anyone else who wishes to testify on, for, or against House Bill 1644? If not, Chair recognizes Representative Oliverson to close.
Thank you, Mr. Chairman and Vice Chair Campos. I appreciate y'all letting me sneak in here and hear this bill. To answer Representative Schofield's question, so 1B penalty group is specific to fentanyl and fentanyl derivatives. So that's they just wrote it a different way. but essentially has exact same meaning. In summary, members, the reason this is going to work and the reason this does work is because greater than 95% of people who come in contact with fentanyl or xylazine through illicit drug use did not intend to take that drug, did not even know they were taking that drug. And it is because of the potency that these drugs are so dangerous. So when you're accidentally exposed, the death rate is incredibly high. I'm not aware of any penalty anywhere in this country where the penalty for taking an illegal drug is death. But in this particular situation, it is. And so if we can pass this legislation this time with your help, we can reduce the number of deaths due to unintentional overdose of fentanyl and give these people a chance at recovery. And with that, I ask for your favorable consideration, and I close.
Thank you. Okay, chair withdraws the committee substitute. If there is no objection, House Bill 1644 will be left pending. Is there objection? Chair hears none. House Bill 1644 is left